Welcome to Roaming with Restless Women, real talk with wise, dynamic women leaders. I'm Julie Noonan, your host, CEO, and founder of Intuitive Wisdom Coaching, and I'm living my dream life. I live and work in my RV, coaching senior women leaders as they navigate corporate politics, family drama, and personal goals to live their own dream lives. These women are restless. They are never done seeking new opportunities, learning, and ways to create value in the world. If you'd like to apply to be a guest, stick around to the end of the show and I'll let you know how. So let's go. Welcome to this episode of Roaming with Restless Women. Today I have Aimee Novotny. Did I say that right, Aimee?
Yes, you did.
Awesome. Okay. Dr. Aimee Novotny teaches individuals how to alleviate pain, stress, anxiety, and insomnia while improving focus, energy, and presence by reducing the tension that builds up in our bodies. The tension that you're holding on to takes energy away from your ability to perform at your best. So, Dr. Novotny founded the PABR Institute with the mission to provide pain, stress, and anxiety relief to those who seek a naturalistic form of treatment when other treatment methods have fallen short, which they often do, as we know.
Yes.
Her unique approach comes from her experience treating individuals in a variety of settings and with a wide range of patient populations over the past 14 years. Her background in orthopedics, sports, geriatrics, balance disorders, nerve injuries, and most recently, chronic pain, and influences from coursework at the Postural Restoration Institute gave her the foundation to develop her unique treatment methods. Her methods have helped countless people reduce and eliminate pain, stress, anxiety, sleep issues, and the need for medications, as well as improve focus, performance, strength, energy, and endurance. It's also helped people to avoid orthopedic surgeries. So, welcome, Dr. Novotny.
Thanks for having me on, Julie. It's a pleasure to be here and I'm excited to share and I'm glad I got to know you a little bit just a bit ago.
Yeah. So, okay, first of all, I have to know what PABR stands for.
Sure. So it stands for pain, awareness, breathing, relief. So a little
Okay.
unique. When I was kind of figuring out what do I call this method that I've developed, and I want people to go from whatever pain there is,
Mm-hmm.
mental, emotional, spiritual, whatever, physical, to relief. What are we doing? We're working on your awareness of your nervous system and changing your breathing mechanics. So there you go.
Oh, okay. And so,
Yeah,
so tell me a little bit about what your journey was like in getting to this point.
yeah, absolutely. So I got my doctorate in physical therapy and I did that for a few years and it was fine. I enjoyed it, but there was a piece that was missing where I saw people in a lot of chronic pain. I saw people in stress and physical therapy, working on stretching someone or strengthening and working on balance didn't always touch that. And their
Mm-hmm.
pain was very tied to that. At the same time, I was training for marathons, trying to qualify for the Boston Marathon. And I started experimenting on my own breathing mechanics and body position. And I realized I could calm my nervous system down and run faster. So I started running marathons pain free. I qualified for Boston and with no trouble at all, with no changes to my routine other than changing my breathing mechanics.
Wow.
And there's a little story behind it, but related to me figuring this out on a treadmill. And it blew my mind. So I started working on myself first, and then I became known for helping people out of surgeries, especially joint replacement surgeries. And then a world famous photographer came from Florida to Arizona, where I was at, to help me get him out of pain so he could avoid a knee replacement. Well, I did help him do that, and he ended up hiring me to travel around the world to coach him in this process. Yeah, that's why I was
Wow.
gonna okay, I'll tell you this process because it's really crazy. It kind of really fits with the theme of your podcast.
Absolutely. I love this. Go for it.
Yeah. So I traveled with him all the way to the Arctic, Arctic Finland, Arctic Norway, all the way down to Antarctica for 6 months in 2018. Literally going all the way to Antarctica, photographing emperor penguins, all of that, and coaching him to keep him out of a knee replacement surgery. And then he had fallen right before he hired me, and
Oh,
told he had a rotator cuff tear, and he didn't want to do that surgery because he was teaching these photo workshops. And so I said, okay, hire me and I'll help you. And he did. And so off I went. And then when I came back, I said, I have to do this and get this out to more people, whether they work with me one on one or at least educate them. And so
Mm-hmm.
I started this business, and that's when it started at the end of 2018. And I've been doing it ever since. And I work with people worldwide and teach them this. Yeah.
That's amazing. So it's not limited geographically.
No, I have people in Australia, New Zealand, London, Chile, Canada, US. Yeah.
Wow. And so talk to me a little bit about how you help them identify where the real pain is coming from, because you mentioned it wasn't just the body.
Right. So when I first work with someone on Zoom, we take an hour and a half to go through what is their problem issue, brought them to see me. Because
Mm-hmm.
sometimes it's indigestion, sometimes it's insomnia, sometimes it's tightness, sometimes it's
Okay.
they have PTSD or some kind of traumatic experience or stress. So whatever, I ask them what it is, and we talk about that a little bit, but then we start to, I look at their body. I have them move. I have them walk for me. I have them bend over, reach. I just watch them sitting. I watch them lying down. So what I'm looking at, I watch the breathing mechanics, is I'm looking at how their nervous system, the fight or flight nervous system, is physically stimulated by
Okay.
all of their daily activities and movements. Because if your physical body is stimulating the nervous system, it ramps you up mentally and emotionally and spiritually. So if
Mm-hmm.
you don't feel comfortable, settled, relaxed in your physical body, it is very hard to calm your mind and your emotions and your spiritual self. And so we also know that emotions get stored in the body.
Yes.
So if our emotions are getting stored in our body and our body is physically being told to be in a ramped up state, you're basically in a tornado within yourself where you can't calm down and just settle. And so I caution people when they do meditation, the stereotypical position for meditation, sit up straight and cross your legs, you're literally putting your body into a fight or flight position. And I tell people, a lot of people, I hear people say, I can't calm down when I meditate. And it's like, well, that's because your body is saying, I'm in fight or flight mode, be racing. And you're trying to say, calm your mind. You're doing it in a position that's ramping you up. No wonder you can't meditate.
Wow.
So we go through changing the whole body and to allow them to release emotion. So sometimes people will cry, sometimes they shout, sometimes they'll switch into a different personality. So it's a whole gamut. It's not just pain.
Okay. And so it's excuse me, essentially it's identifying what the body's telling you
Mhm.
and then figuring out with your help how to release that.
It is, yes, because
Okay.
our bodies are very communicative. They
Mm-hmm.
really do tell us things. It's, are we listening and do we know the language? Can we figure out the language and help it, especially this nervous system, the autonomic nervous system? That's where the key is because it affects every organ system. So if we don't address that, we aren't really going to address ourselves from within.
Right. And if it's impacting, is it hurting the rest of our systems?
It is, absolutely.
Okay. All
Absolutely. If
right.
you're not learning to calm that nervous system, it is definitely hurting other systems. That's why the the quick and easy phrase stress kills, it's out there because yes, we think about it associated to the heart and the cardiovascular system,
Mm-hmm.
but it's associated to the digestive system. It's associated to your integumentary system, your skin. It's associated
Wow.
with your musculoskeletal system, which is part of my specialty and how that relates to your emotion in your mind and your brain. So it affects everything.
So when give me an example of someone that came to you, had, some pain or some anxiety or whatever the case, and how did you help them, and what was their goal, basically?
Sure. So I'll give you I can give you a couple scenarios, one that's kind of standard and one that's unique. I'll start with the unique one because it's not very common. So a lady came to me having nightmares. And she
Oh,
said I would wake up with nightmares in the middle of the night, my heart racing, which is not, a lot of people have nightmares, but it's not something you usually go to see someone for. And she
yeah.
mentions a little bit of body issues too, like a little bit of back pain because she was so tight from these nightmares. And so what we worked on is how do we get the body to be calmer during the daytime?
Hmm.
So your body knows how to calm down at night. So her nightmares that she has, that she's trying to process something, but her body was in such a state that she couldn't let go. And so
Okay.
when we got her to be calmer during the daytime and to change how she held her body position, like her ribs, they had to drop down. She had to feel her belly spill out, her body relax into her chair when she was working it for her job. She could feel calmer during the daytime. And of course, most people are like, yeah, whatever. And she was the same thing. I don't think this is going to work. And I had her do a little practice before she went to bed or in bed too. And then within a couple sessions, she didn't have nightmares anymore. And at first she said, oh, I've had these cycles where it goes away. But literally they didn't come back. And her back pain resolved as well. So that's one
Oh, wow.
that's
Okay.
more unique. Then like I'll go through another one. A lady has scoliosis, back pain for years. She's tried everything
Mm.
out there to try to fix it. Egoscue, physical therapy, chiropractic. She's done like all these different common and non-common modalities. And so we started working on her. And so the first thing I said is we have to get your rib cage to drop down, change your breathing mechanics so you can feel your ribs let go. We have to get them to let go and free up. And she did. And within a few sessions, she was pain free. So now she wanted to go longer. And so we're working on getting her scoliotic curves to correct. And she's made huge gains in that. And she doesn't have pain. She's in her mid to late 70s. She can go up and down stairs. She carries groceries from the farmer's market. She plants a garden every spring and lugs pots around. So that's kind of another scenario, more on the physical side.
Yeah. Wow. So when do you diagnose that it might be something beyond your capability? So for instance, there's somebody that presents with a real, like they need to go and see a mental health professional or something like that. What happens in those situations, or does it?
Um, a lot of times if someone has a let's say a mental health crisis,
Mm-hmm.
most of the times they are already seeing a psychologist or psychiatrist, and a supporting member of.
Got it.
Occasionally someone might, but usually they're already seeing someone.
Yeah.
And then they're stuck and they're trying to get further along in their progression. But occasionally I might see someone who I say, have you tried EMDR with someone to help you let go of something?
What
Or
is
have
what is EMDR?
So EMDR, it's a rapid eye movement technique that psychologists use to
Okay.
help people access a different part of their brain to
Okay.
allow them to let go of a traumatic experience. So it
Okay.
involves some movement of light, and they're going through a process with the psychologist. I am not trained in it,
Right,
but
right.
I'm familiar with it, and I refer out to other people to do that with someone.
Mhm.
And for the most part, it's usually 8 to 9, 10 sessions that they work with a psychologist to help them move past that trauma. And there's a lot of success in it. It's not 100% just like anything, but there's a lot of success in it. And so there are times where I say if someone's holding on to something, I may suggest that or suggest that they have some kind of person helping us that with skills and techniques that I'm not skilled in.
And where in the body do you most often see people holding on to tension and stress? You've mentioned the rib cage a couple of times. So where else?
Yeah, so the armpits, that's a big one.
Really?
Huge, huge, huge. It's well, all of these things are connected to the rib cage. So the rib cage is basically our supporting structure and we guard through it. So a lot of
Right.
things, so I'm going to mention everything I mentioned is going to be attached to it. So armpits, the breastbone, the base of the breastbone where the ribs come
Hmm.
together and meet the breastbone. That's the biggest one where people hold on. And
Right.
then, yep.
The
right in there.
solar plum, well, I
Yep.
call it my solar plexus, but that's
Yes.
where everything happens for me.
Mhm.
Yeah.
Yep. So that's the biggest guarded area. And
Uh-huh.
you can, and I'll go into that in just a second, but the front of the hips and the low back. So those are all areas where people
Mhm.
hold emotions. The solar plexus, or right underneath the breastbone,
Mhm.
is a big one, and you can spot whether someone has tension in their body immediately, just by looking at them. So I can tell by how they hold their rib cage how
Mhm.
much stress and trauma that they've had in their life just by looking at that. And,
Wow.
inside, like, I feel for that person because I'm like, they've had some stress in their life. And I don't like to hear that. No one likes to hear that someone's
Yeah.
had a rough life. So, but you can tell how anxious a person is, how on guard they are, all by how they hold the rib cage and how tight they hold it there.
Now I'm getting all, okay,
Don't
don't
worry,
let
I'm not picking you apart. I can only see
me.
shoulders up. Oh, I can tell a little
Good.
bit.
Okay, good, good, good. And sometimes I feel better when I lower my shoulders. I find a lot of times when I'm when I notice that I'm feeling anxious, my shoulders are really tight. And when you said armpits, I realized, oh, okay. When I'm feeling open, and when I was in theater, this was one of the things that I had to help people understand all the time. When you're holding tight in your upper arms, if you
Mhm.
can't let go, your audience is not seeing you be open. You're not embracing the character that you're playing. You don't seem real in that character if you
Right.
can't open up and absorb them. So that made a whole lot of sense when you said armpits, because
Yeah.
yeah, that's a big one.
Yep. And to help you even further, it's not pull your shoulders back, it's lower your ribs so your shoulders can drop down.
Yes.
So if you
Okay.
pull your shoulders back, you'll kick in your back muscles, which will ramp you
Hmm.
up because it will compress on the fight or flight nervous system. But if
Got
you
it.
allow the belly button to relax so your ribs drop down, the shoulders drop down, your body will relax. So,
Very good. Wow, that's amazing. I'm going to try that. Okay.
yeah.
So, what's the most challenging thing about being a woman entrepreneur?
I would say I don't even know if it's being a woman per se, but what I do is very esoteric.
Hmm.
It's not, let me sell you an apple.
Right.
So it's hard to communicate what I do in a very short period of time that meets people's attention spans. So
Yeah.
that I would say is the hardest part. Um, as far as the woman part, I would say juggling. I have a little 16-month-old boy. So
Oh,
being a mama and doing this at the same time, I would say that bring the woman part of that, bringing that in, and wanting my desire to want to spend as much time with him as possible and do this. It's a tug of war internally that you know, I go through just because I'm a human being and I'm a woman and I want to care for him. That's all.
absolutely.
Yeah.
Absolutely. And so, was there in your life, where did you first notice perhaps that you had some of that tension?
I remember having tension growing up. I grew
Okay.
up with my mom and one of my brothers, and she was mentally not stable. And
Mm,
so it was kind of like Dr. Jekyll, Mr. Hyde. When I woke up, I wasn't sure what kind of mom I was going to get. And so
okay.
I lived in tension for as long as I could remember. And when I first went to physical therapy school and was getting my doctorate, and we learned about these type of issues, that's when I first started thinking, I need to start paying attention to my health because I didn't.
Mm,
I was the worst culprit. Drank 6 Mountain Dews a day, ate only processed food, honey buns, Cheetos, all of that growing up.
all the good stuff. Yeah.
Oh, yeah, exactly. And so finally, in my early to mid 20s, I finally said, okay, I gotta start paying attention to this. But I didn't really even understand it until it was late 20 or late third or no, late 20s, early 30s when I realized the impact of the nervous system. And I was already running marathons and I wasn't able to get rid of all the marathon pain that they say. And I was like, I'm doing everything perfectly according to the physical therapy world. What am I missing? And this was it.
Yeah.
And so it was kind
Wow.
of mid-30s when I finally was like, oh, okay, now I can release it. And now I get it. But 30 some years of tension to finally get to a point where I could release it. And I'm working with people that same age, older, younger. So tension and stress is ubiquitous. But that's why I'd say pain is not related to aging. Pain is related to how much stressors add up in your life.
Absolutely. Absolutely. So, I have three questions that I ask usually at the end of all of my episodes.
Sure.
The first one is I'll ask you to close your eyes just for a
Okay.
moment
Okay.
and describe the pic. Go ahead and close your eyes
Okay.
and describe the picture that appears when I say wise woman, and then open your eyes and describe her to me.
So I would say for me, it's an older woman who has a lot of wrinkles, but a peace in her.
Mhm,
Um, no makeup on, curly hair, um, strong,
mhm.
and someone who has fully lived life, has
Yeah,
never said, no, I can't do that when she really wanted to do it. She said, I'm going to forge ahead. That's what I see.
absolutely. The strength theme comes up in almost every one of those answers that I
I can
get. I
imagine.
love that. Where do you like to roam?
For me, Arctic climates. I've been to Greenland, Iceland twice, Antarctica, and I would like to go back.
Oh my goodness. Well, I know that you mentioned the penguin photos,
Yeah.
and that was with the photographer that you traveled with, correct?
Yep, so I'm a photographer as well, and so
Okay.
I got to do that. That was the reason I said yes to go because I wanted to go. I wanted to photograph as well. I mean, yeah, it's a really neat, unique experience, but I wanted to travel and photograph. So yeah,
That's
yeah.
amazing. So are you planning your next trip now?
Not well, in my mind, yes, but I have to wait till my little one gets a little bit older because it's just me and him, and I want him to be fully engaged in the environment when
Mhm.
we travel. So we just do little stuff now.
Yeah. Well,
Yeah.
hey, if you're getting him out and about, that's all that matters at this point, right?
Yeah, exactly, exactly.
Final question for you. What makes you restless in a good way?
Knowing there's so much I have to learn still, so much that I want to get exposed to, cultures I want to learn about, animals that I haven't seen that I want to photograph. All of that makes me restless.
So you're mainly an animal photographer.
Animal and landscape. I
Okay.
do people if they want it, but I'm mostly drawn to animals and landscapes, unique places. If I was in Africa, I would ask and I would want to photograph the people too there, but if
Yeah.
the cultural aspect of it, I'm just drawn to.
Yeah, absolutely. Well, Amy, it has been a total pleasure. And folks, I will put in the show notes links so that you can get a hold of Amy, so you can take advantage of all that she is offering as far as relieving some of your stress, anxiety, pain, or all of it, hopefully. And so we will put that in the show notes. And thank you so much, Amy, for agreeing to come on the episode. I really appreciate it.
Thanks, Julie.
Julie Noonan here. Thank you so much for listening to Roaming with Restless Women. If you're a successful senior woman leader who would like to be on this program, please visit podcast.intuitivewisdomcoach.com. If you enjoyed this interview, please share this episode on social media and make sure to subscribe so you don't miss any future episodes. Your thumbs up, ratings, and reviews go a long way to help promote the show, and they mean a lot to me, my team, and most importantly, my restless guests. As a special gift to you, our listeners, I offer a free one-on-one 15-minute breakthrough session. Bring a problem and experience how coaching works to see if it could be of value to you. Sign up for an available time on my website, intuitivewisdomcoach.com. Thanks for listening, and we'll see you next time.